In this short video, the student should learn popular regulation of medical device in critical markets from law to guidance and standards. Here are the agenda. We start the highest law of medical device in US and EU. Taking Canada as example, we introduce some prominent guidances to follow. In second step, we take an example of matching supporting regulations to highest legislative in Chinese market. One important legislative is standard, which plays a great role for developing and registering medical device. At the end, we want to provide some ideas to follow diverse regulation at international market. The legislative of medical device at global market is broad. The legislative is also regulatory requirements, meaning any part of a law, ordinance, decree, or other regulation which applies to medical device manufacturers. The highest legislative or regulation of medical device is binding law. Here are oldest and famous laws of medical device. Federal Food, Drug, and Cosmetic Act since 1938 in US, Medical Device Regulation since 2017 in EU. Let us have a look at hierarchy of regulation in Canada. On the first level is Medical Devices Regulations SOR 98-282. On the second level is guidance as Draft Health Canada IMDOF Table of Contents for Medical Device Applications Guidance on the Risk-Based Classification System for Non-In Vitro Diagnostic Devices, non-IVDDS, Guidance for the Labeling of Medical Devices, Guidance on Clinical Evidence Requirements for Medical Devices. There are also recognized standards of medical device as biocompatibility, cardiovascular, electromedical, general in vitro diagnostic materials, ophthalmology, orthopedics, radiology, sterilization. To better understand the context of regulation, it is essential to trace regulatory requirement among law, guidance, and standards. Let us gain a transparent overview in Chinese medical device market. The highest regulation is so far State Council Order 739 in 2021, Regulations on Supervision and Administration of Medical Device. Let us match the article in this order with supporting guidance. Article 13 Classification is to match rules for classification of medical devices. Article 30 to 36 Chinese GMP is to match to guidance for medical device production, quality management, and other specific GMP regulations, even standards. Article 38 UDI is to match diverse regulation and standards of UDI. Article 39 Instructions and labels is matched to instruction for use and labels of medical device. Chapter 5 PMS is supported, for example, by adverse events monitoring and re-evaluation of medical device. Guidance for compiling annual self-examination report of medical device quality management system, Order 13, 2022. Standards of medical device are indispensable for manufacture of medical device. At IMDOF, the standard is defined as document, established by consensus and approved by a recognized body, that provides, for common and repeated use, rules, guidelines, or characteristics for activities or their results, aimed at the achievement of the optimum degree of order in a given context. We list some typical basic, group and product standards. The typical basic standards are ISO 13485, Quality Management Systems for Medical Devices. IEC 60601, Safety and Performance Requirements for Medical Electrical Equipment. Product-specific standards is like IEC 62304, Software Life Cycle Processes for Medical Device Software. How to trace and implement the global regulation of medical device. We recommend following regulation of medical device from authority, regulatory institution, and consulting. The familiar site is like International Medical Device Regulators Forum and CDRH Learning at FDA. One of the challenging action is to categorize the regulation for the own regulatory affairs group. It could be general regulation as law, classification, pre-market regulation as technical documentation, post-market regulation as vigilance, post-market surveillance, quality management as inspection, Production clinical evidence as clinical evaluation and clinical trial product-specific regulation and standards as IEC 60601 series for active medical device. Manufacturer should has own process to monitor, analysis and maintain international regulation of medical device.